Hi everyone, I'm Chen Ling from National Taiwan University, Department of Veterinary Medicine. Today we're going to talk about canine and feline pancreatitis. We'll start from to introduce the anatomy of pancreas and the etiology or pathogenesis of pancreatitis. And then we were going to talk about how to diagnose it and then the brief introduction of the treatment. So when we talk about pancreatitis, we will mainly focus on exocrine pancreas. The exocrine pancreas, the disease about the exocrine pancreas will mainly are categorized into two kind of diseases. One is pancreatitis. It's about the inflammation and necrosis of exocrine pancreas. And another disease we need to care about is about the exocrine pancreatic insufficiency. There are many causes to result in exocrine pancreatic insufficiency, and the pancreatitis is one of the reasons. When we focus on pancreatitis, it is a common disease we can found in dogs and cats. And the diagnosis of pancreatitis requires the integration of many aspects, including clinical presentation, image finding. For example, we need ultrasonography or radiology to help us to look up if anything wrong about our exocrine pancreas. And also we need to do some blood examinations such as CBC or biochemistry to help us to do the diagnosis. But if we want to make the definitive diagnosis, maybe we need some histological examination. But I believe that in clinical cases, we seldom to do this kind of examination. And another important issue we need to focus about exocrine pancreas is exocrine pancreatic insufficiency, just as I mentioned before. There are many cases to result in EPI. However, pancreatitis, if the pancreatitis is not well treated, it may result in EPI, and the outcome of EPI will be expressed as malassimilation. That means this exocrine pancreas cannot produce any digest enzymes such as amylase, lipase, or trypsin that will result in maldigestion. And so when we focus on digestive, when we face some problems about the digestive system, we need to differentiate if the problem is due to maldigestion or malabsorption. So we will look closer about the anatomy of the pancreas. This is the pancreas. The pancreas is very close to duodenum, so we can see the digest enzymes such as amylase or trypsin or lipase produced by the pancreatic acinar. This enzyme will be into the pancreatic duct, and the duct will open and in the duodenum. So when foods are passed from stomach to the duodenum, they will contact with these enzymes and do some digestion functions. This the basic anatomy of the pancreas. So if we look closer, we can see these are the pancreatic acinar, and all the digestive enzymes are produced within this acinar, just like this. And That are the digestive enzymes. Okay, when we face pancreatic problems, what can we do to help us diagnose the pancreatic abnormalities? We can do the following diagnosis method. We can use biochemistry analysis to evaluate the level of alpha amylase and lipase. As well as we can also use trypsin-like immunoreactivity or pancreatic lipase immunoreactivity assay to help us diagnose pancreatitis or EPI. When we see immunoreactivity, please do remember that this kind of assay, we use antibody to specifically recognize trypsin or pancreatic lipase. So please use please choose the correct species. We cannot use canine assay to detect a feline lipase level because they will lead to some misconduct, misinterpretation of the result. So the first enzyme I want to introduce is about alpha amylase. Alpha amylase is produced and stored in pancreatic acinar, and when pancreas is injured, these enzymes will leak into plasma or in the abdomen. So this enzyme is a calcium-dependent metal enzyme. It is secreted in the active form, and the major function of this enzyme is to hydrolyze the carbohydrate to form maltose and glucose. Just as I mentioned before, this enzyme is produced from pancreas. However, it will also be produced in small intestine, in duodenal mucosa, liver, in these different organs. So that means when we detect some elevation of these enzymes, it may show some signs of pancreas injury, but we cannot rule out the problems from small intestine or liver. Also, because this enzyme is secreted through kidney, so kidney problem will also result in the elevation of alpha amylase. So basically, inflammation of pancreas will release large amount of alpha amylase. So if we detect the level, that will be more than 3 times of normal reference value, we can maybe have some confidence to say, this case is maybe acute pancreatitis. But if the elevation is not so high, maybe just around 2 to 3 or less than 2 times above normal reference value, we may need to do more investigations or more examinations to help us diagnose what kind of problem we face. So basically, if we only count on alpha amylase, it's not a reliable indicator of pancreatitis in dogs and also in cats, because we have found from the previous publications, we have found that many cats with pancreatitis, however, they possessed normal serum amylase. So normal serum amylase does not help us to rule out the diagnosis of feline pancreatitis. And just as I mentioned before, because damage the pancreas will release amylase, will result in amylase release in serum as well as in abdomen. So if we if we have some ascitic fluid, we can also detect the high level of amylase in animals with pancreatitis or intestinal disease. The second pancreatic enzyme we will focus is about lipase. Lipase hydrolyzes triglyceride. It helps us to catalyze triglyceride, and then this metabolite will be absorbed by our intestine. So the lipase activity will be optimum at an alkaline pH and is enhanced by bile. So basically, the active lipase will be in our duodenum to help the digestion. The pancreas and the gastric mucosa are the only known source of lipase. So basically, just like amylase, lipase produced mainly in pancreas and are degraded by kidney. So please do remember that if any kidney problem, it will also result in maybe some elevation of lipase. So if we want to do some diagnosis of pancreatitis, we will suggest please do amylase and lipase parallelly. If they are both increased, it will help us to have more confidence to say this case maybe are pancreatitis. But however, we still face the same problem as we mentioned in amylase, that some cases, some dogs and cats, even they are finally diagnosed with pancreatitis, they may have normal lipase or amylase level. So maybe we need to do some more tests, just like trypsin, like immunoreactivity or pancreatic POI, something we will introduce later to help us to do the final diagnosis. So similar to amylase, if the serum lipase level are higher, three folds higher than the normal reference value, it may indicate acute pancreatitis. However, we still have some exceptions, such as we can see, because they have some, because as we can see, the lipase activity increases within 24 hours and peaks at 2 to 5 days. That means if we are not in this window, we may miss the best opportunity to find the elevation of lipase. And we can also find this based on some studies to indicate that up to 28% of dogs with pancreatitis, but their lipase activity remains within the reference interval. Moreover, we can find that peritonitis, gastritis, bowel obstruction, as well as visceral manipulation during laparotomy, hepatic disease, or even neoplasia. There are many diseases will increase serum lipase activity. So that means we cannot use only one lipase enzyme to help us diagnose pancreatitis. So we highly suggest to use amylase and lipase concurrently to improve the diagnosis of acute pancreatitis. So if they increase or decrease parallel, it will help us to further confirm our diagnosis about pancreatic disease, such as pancreatitis or EPI. So the following two assay, trypsin-like immunoreactivity or pancreatic lipase immunoreactivity, will currently are more often to used in clinical to help us diagnose pancreatitis or EPI. So trypsin-like immunoreactivity, trypsin is also a pancreatic proteolytic enzyme. If pancreas injury occurs, it will leaks into the serum or into the abdomen. Basically, this assay depends on a specific antibody. That's anti-trypsin precursor antibody, and not the anti-trypsin itself, because trypsin is the function of trypsin is about to digest protein. So we don't really have so many trypsin in the blood that will cause the massive damage. So basically, we use antibody specific to target trypsin precursor. And this kind of assay will tell us about if the level of TOI increases, it will partially to indicate the acute pancreatitis. But if the TOI level decreases below the normal reference, and it will tell us about the greater possibility about exocrine pancreatic insufficiency. So how to perform POI? We need 2 milliliter serum or plasma, and just as I mentioned before, these immunoassays are species specific. So the assays for one species, for example, for human, we cannot use human assay to detect animal TOI. It will lead to the not correct TOI value, so will lead to misinterpretation. So we will collect the serum, and these animals will need to be fasted for 12 hours to prevent sample lipemia. Then we will collect this kind of serum for the TOI assay. So this basically TOI is a very sensitive assay for us to diagnose EPI more than to diagnose pancreatitis. If we have the abnormal value index, if we have the value as below per liter 2.5 microgram, it will be very it will strongly support us to say this case is highly possibly EPI. And if the value is higher, above the per liter 35 microgram, we can say it as maybe acute pancreatitis. But we'll talk about later what we cannot jump to the conclusion, say that, oh, if we found this value, we can say, oh, it's acute pancreatitis. TOI is decreasing dogs and cats with EPI. This is definitely demonstrated in many studies as well as in clinical findings. However, TOI is increased inconsistently with nucleotizing pancreatitis. That is because the short life of this trypsin precursor. Because this kind of trypsin precursor, the half-life is around 30 minutes, so it increases earlier and decreases more rapidly than amylase or lipase. So we may miss the window. If we found the TOI is not elevated, maybe we are just not in the window. So that is why we cannot. We don't. That's why we don't usually count on so much on TLI to help us to do the diagnosis of a pancreatitis. And moreover, we also found that some healthy dogs and healthy cats, they have higher TLI values, just as we found in animals with pancreatitis. So based on these two issues, we suggest that TLI is a better tool for us to diagnose EPI instead of pancreatitis. So far we have introduced amylase, lipase, and TLI, the three methods, and we realized that we can use both lipase or amylase together to make us diagnose pancreatitis with more confidence, but we still cannot say it very definitely about if this animal has pancreatitis or not. So maybe we need another better, powerful tool to help us. So we can use. So now we focus on pancreatic lipase immunoreactivity. We can call it PLI for short. PLI currently is a very useful tool for diagnosing canine pancreatitis. Because it's an immunoreactivity, so it also uses antibody to specifically recognize pancreatic lipase. Because I think I just mentioned that lipase is produced not only in pancreas, it will also in other organs such as liver, such as duodenum. But this assay, they use antibodies specific recognize lipase from pancreas. So that is why this assay is powerful, somehow more powerful than other assays for us to diagnose pancreatitis. Currently, I think in the market we have many products to choose. So I just take one of the products for example. This product they use ELISA, basically they use ELISA assay, and it will help us to detect the real value of the pancreatic lipase. And the canine normal reference value will be 2 to 100, around 2 to 100 microgram per liter. And if we have the value, if we have the value over per liter 200 microgram, we can say it has greater possibility that this dog has pancreatitis, and it shows we maybe have some sensitivity around 82% compared to lipase, the sensitivity 55% and TLI 35%. So according to the data, we can have a much powerful tool for us to diagnose pancreatitis. That we use in the lab to use ELISA assay. But if we just in the bedside, we need to know if this dog has a pancreatitis or not right now. We can use this kind of snap kits. Just take one of the product, for example. So this kind of example is we only take 10 minutes to help us diagnose pancreatitis. So we have a reference value here, and this is our sample. We can load our serum sample here, and then maybe we need to, around 10 minutes, we can compare our sample to the reference, and that will tell us if this serum contain pancreatic lipase, and we can, because it's a semi-quantitative method, so if the color is darker than reference dot, we can see that this pancreatic lipase level will more than 200. Okay, so it's a very easy product we use to help us diagnose pancreatitis. So just as I mentioned before, if our sample load into this kit and we can see the sample color is darker than the reference dot, we can realize that this animal currently has very high level of pancreatic lipase. So that's what we see. So currently we just introduce four methods, four different two enzymes, two different assays to help us diagnose pancreatitis. However, we still need some other laboratory findings to support us to do to confirm our diagnosis. So we confirmed, if we perform CBC assays, it will the pancreatitis cases will show us about leukocytosis and neutrophilia with a left shift, as well as these neutrophils may have toxic changes. These are the typical sign of inflammation. So it will help us to strengthen our diagnosis about pancreatitis. Or sometimes we may also see eosinophilia or occasionally monocytosis. So basically, they are inflammatory conditions we confirmed. And also we will find some fasting hyperlipidemia. So even these animals, they didn't eat food for a long time, over 12 hours, we still could find the lipemia in the serum. So why? That is because the leaking lipase, they will start to dissociate the fat tissue, the adipose tissue, then release the triglyceride in the serum. And this released fatty acid will subsequently bind to calcium. So we can also find, because our calcium is bonded with the fatty acid, so we can find the hypocalcemia in the animals. So this phenomenon is called saponification. These laboratory findings will help us together with the amylase lipase test, together with the pancreatic lipase immunoreactivity assay. It will help us to jump to the conclusion about the pancreatitis diagnosis. So this table summarizes the classical segment, the weight, the risk factor, and the clinical sign, as well as CBC biochemistry finding, also some radiography findings or ultrasound findings to help us together diagnose the pancreatitis. If we summarize what we found in pancreatitis, we can know that because this intestinal system, pancreas and the liver, and because the both pancreas, both liver, they contribute to the digestive function in the intestine. So they are, as well as they are very close organs within the abdomen. So if we have pancreatitis, the leaking enzyme and the inflammatory condition will also affect stomach, will also affect intestine or liver. So it will cause not only the increase of pancreatic associated enzyme. Sometimes we may also see the elevation of liver enzymes as well as the bilirubin increase. Moreover, because lipase or amylase, they are secreted by the kidney. So if the animal has kidney function insufficiency, we can also find the change, basically the elevation of UN or creatinine. So it's a summary picture to help us overview what will be observed within the blood if we have pancreatitis, if the animal have pancreatitis. So just as I mentioned before, as we talk about the problem of the exocrine pancreas, we cannot just only focus on pancreatitis. We also need to look at exocrine pancreatic insufficiency. That's called EPI for short. And basically, EPI is the inability to properly digest the food due to the lack of digestive enzymes. And so if we lack these digestive enzymes, it will cause the weak of the animals. So finally, they don't have enough energy, they cannot possess normal physiology functions. So EPI is caused by a progressive loss of pancreatic cells that make digestive enzymes. We can usually find in dogs, and when EPI occurred in dogs, it is caused by pancreatic acinar atrophy. So why the acinar atrophy happened? It happened. Maybe due to previous infections, maybe due to blocked pancreatic ducts, or they have some genetic defect to cause this acinar atrophy. Another very important reason is chronic pancreatitis. So just as I mentioned before, if we cannot do the right diagnosis, or if the animal have chronic pancreatitis without a proper treatment, the final outcome will be to result in pancreatic acinar atrophy and to result in EPI. So basically, if the animal has exocrine pancreatic atrophy, we confound in blood, it will show the decrease of pancreatic lipase immunoreactivity and decreased trypsin-like immunoreactivity. So there's the two immunoacids we just mentioned before, and these two immunoacids will help us to diagnose EPI. And because the lack of digestive enzyme, so subsequently, the animal will also face the decrease in serum the decrease of vitamin B12 or vitamin E in serum, and this is not good for the animal health. So we have completed about the brief introduction of the diagnosis of pancreatitis. So how to treat it? Currently, we don't have the treatment. We are focused on to relieve the symptoms and to make the animals much more comfortable. So we can use supportive therapy, maybe fluid therapy, to support the nutrition, to support the fluid, to supply the fluid and electrolyte. Also, we use some anti-vomiting, anti-diarrheic drugs for recovery, for save more energy for the animals. And sometimes we may also use freezing plasma, and this freezing plasma will help the animal. It will to clear the trypsin or the digestive enzyme within the blood, and to prevent the possibly damages caused by these enzymes. And also, this plasma will provide proteins and the coagulating factors, and these proteins are for tissue regeneration. And also because when animals are in pancreatitis, they face very severe inflammatory condition, and they will cause coagulation problems. So this plasma will provide the coagulating factors to reverse the problem of coagulation difficulty. So in this section, we briefly introduce the etiology, the pathogenesis, the diagnosis, as well as the treatment of pancreatitis. And thank you for listening. If you have any questions, please don't hesitate to contact me with the email provided in this slide, and I will be very glad to answer the comments and the questions from you. Thank you so much. Thank you.